Let's review neurofibromatosis type 1. Neurofibromatosis type 1, or von Recklinghausen disease, is the most common phagomatosis and is characterized by multiple melanocytic and neuroglial lesions. The inheritance pattern for NF1 is autosomal dominant in about 50% of cases. The rest are sporadic. The NF1 tumor suppressor gene encodes neurofibromin. Café au lait spots are the most common skin finding in NF1. They are described as uniformly hyperpigmented macules. On histopathology, giant or macromelanosomes are a characteristic finding. Nodular cutaneous and subcutaneous neurofibromas, or fibroma molluscum, are the most common lesions of neuroglial origin in NF1. Neurofibromas are the most common peripheral nerve sheath tumor. Histopathologically, they are described as loosely arranged bundles of endoneurial fibroblasts, Schwann cells, and axons. They are not encapsulated. Neurofibromas stain positive for S100 protein on immunohistochemistry. Plexiform neurofibromas are arranged in an intricate network that may be present anywhere on the body but affect the face in about 10% of cases. This plexus is classically described as a bag of worms. The upper eyelid and orbit are often affected, causing an S-shaped ptosis from temporal eyelid involvement. Plexiform neurofibromas are considered pathognomonic for NF1. The CCN1 gene is associated with plexiform neurofibroma formation and may be a useful diagnostic or prognostic marker. Deprivation amblyopia from ptosis or refractive amblyopia from induced astigmatism are possible. Surgical debulking and frontalis suspension may reduce the ptosis if there is any risk to vision. Ipsilateral glaucoma is found in up to 50% of cases of NF1 with an eyelid plexiform neurofibroma. If glaucoma is present at birth, it is thought to result from abnormal angle formation. If glaucoma develops later in life, either infiltration of the angle with neurofibromatous tissue or angle closure from ciliary body and choroidal thickening is thought to be the mechanism. Gliomas are low-grade pilocytic astrocytomas and can affect the optic nerve chiasm or both. Around 15% of NF1 patients have gliomas. Conversely, patients with optic pathway gliomas often have NF1. On MRI, there is often fusiform or cylindrical enlargement as shown by the red dashed lines, as well as kinking or increased tortuosity as shown by the white arrow. Only 1 to 5% of NF1 patients with optic pathway gliomas are symptomatic. Chiasmal gliomas may cause hydrocephalus and hypothalamic dysfunction in addition to bilateral vision loss. The histopathologic description of gliomas is a proliferation of spindle-shaped astrocytes with delicate hair-like cytoplasmic processes, hence the term pilocytic. Rosenthal fibers are strongly eosinophilic filaments representing degenerating cell processes. Bony defects such as scoliosis, pseudoarthrosis of the tibia, and sphenoid hypoplasia may be seen in NF1. Sphenoid hypoplasia may present as a pulsatile proptosis. Prominent corneal nerves are seen in less than 20% of NF1 patients. Lisch nodules are dome-shaped melanocytic hamartomas of the iris present in nearly all adults with NF1. Iris ectropion, in which the posterior iris pigment epithelium migrates to the anterior surface of the iris, may be seen in NF1. Like plexiform neurofibroma, its presence in NF1 is associated with a higher risk for ipsilateral glaucoma. Multiple flat hyperpigmented choroidal lesions are commonly seen in neurofibromatosis, but may require near-infrared reflectance imaging to readily visualize. These lesions do not have any impact on vision. On histopathology, choroidal neurofibromas demonstrate diffuse infiltration of spindle-shaped cells with slender, wavy nuclei. Rarely, NF1 is associated with other benign ocular tumors such as juvenile xanthogranuloma, retinal capillary hemangioma like those seen in von Hippel-Lindau disease, and retinal astrocytoma like in tuberous sclerosis. In rare cases, NF1 patients may have pheochromocytomas. NF1 and von Hippel-Lindau are the two phagomatoses associated with pheochromocytomas. In addition to neurolamomas and meningiomas, NF1 is associated with many other systemic problems including some malignancies and central nervous system abnormalities. Here are our references. Thanks for watching. Please follow us on Facebook, Twitter, and Instagram. If you find content like this helpful, please like this video and subscribe to our channel. Consider supporting us on Patreon. Your support helps us create more review resources. Happy studies!